age, our knees and hips often simply wear out. Cartilage can become worn down and damaged, and tendons and muscles end up overused. The good news is there are treatment options. Joining us to discuss them is orthopedic surgeon Dr. Charles Stewart. He is a hip and knee specialist. It is great to see you.
Thank you for having me.
So we hear a lot of ads or a lot of talk about PRP. What is that, and how does it relate to hips and knees?
So PRP is platelet-rich plasma. So it's a part of the blood. We can take your blood, we can spin down the blood, take the platelet portion of the blood. The platelets are the first responders to a site of injury.
Okay.
So as you get those platelets, inside the platelets, there's hormones, growth factors, healing enzymes that are designed to initiate a healing response. And so we can isolate that healing part of the blood and inject that into a site of injury. And in an arthritic knee, we can inject that in there and initiate a biological healing response. And it really has been shown to prove much improvement in symptoms. Really reduce pain, reduced inflammation, improve function for people, lasting out months, even years.
Linda and her bad knees have questions. She's about to explode with excitement.
This is so exciting. I had a hip replacement years ago. I would not be working today if it hadn't been for that, because it has been great. But I need to have my knees done, and I'm so excited to hear about this.
This is great. This is going to definitely extend the time for people, because when you're ready for a hip or knee replacement, it's all about how badly does it hurt you. And if we can reduce the pain, reduce the inflammation, get you back functioning, doing the things you want to do, you might be able to delay it. You might be able to kind of maintain that quality of life for longer before you need to go on to have it replaced.
Are some people better candidates than others for PRP? Do you have to have a certain level of degradation?
Traditionally, if you ask the average orthopedic surgeon whether or not it's a good idea if the people are bone on bone, there's a general concept that if you're bone on bone, the PRP might not work as well. In my experience, however, I would tell people, you're bone on bone. You might not be the optimal candidate, but I've found many people have really great success with it.
So it might be worth a try to ease pain.
Yeah.
I mean, pain stinks.
Even if it's less likely to work, it doesn't mean it's not likely to work.
All right, good.
I offer it to many people, even when they are bone on bone, because what if it does?
Right.
What if it does give you a year?
I like that
Why not?
optimistic outlook, especially if you don't want to go through the rehab of surgery.
And the papers, often 85% of people seeing significant benefit with this.
Oh,
I mean,
that's
really
wonderful.
high rates of
Just
success.
made Linda's day.
So if the numbers come down and it's not as successful, it still might be 70, 80% of people
I don't need to walk like a 35-year-old, but I'd like to walk as good as I possibly can, and that would be a great breakthrough for me.
Well, let's talk about that next step, which of course is often surgery and replacement surgery. Robot-assisted surgery has become a big buzzword right now, and you said there's a lot of myths around that. Tell us about it.
So when we first started doing robotics in surgery, we didn't know how it was really going to evolve and how it was going to change things, because we found that initially there weren't huge differences in the outcomes. But because of the guaranteed precision and the way we can adapt a plan intraoperatively, we can really match somebody's native anatomy. And what we do is a patient-specific functional arthroplasty is now the term for it, which is really only possible because of the precision of a robot.
Okay.
And we're able to adapt the knee replacement to your own anatomy. And that changes. Everybody has a different knee. All the deformities come in differently. And these subtle differences that we can make with the robot make a big difference in the overall outcome.
So you sound very positive about enjoying working with the robot.
It was surprising how great it was. I was not expecting to love it as much as I do, but I really do. It's amazing.
Would it mean faster recovery time afterwards?
So that was one of the things that I initially did not believe it was going to, because I just thought that maybe people would like it in the long term, but I found people to be doing so much better in the first couple of weeks. It's really been alarming at how well people are doing. I was so impressed with it. To the point where I only do knee replacements robotically now. That's the only way I'll do it.
Oh, so it cuts down on pain too?
Less pain, better function. They come in at 2 weeks, a lot of times not even using a cane. It's amazing.
Oh my.
I'm still surprised.
And so whether it's PRP, whether it's the robot-assisted surgery, for someone who's just been given, say, an arthritis diagnosis, are all of these things that can eventually help as arthritis progresses?
That's why it's important to come to an orthopedic surgeon who specializes in hip and knee, so we can talk about the totality of treatments that are available. It's not all one, you have to have knee surgery, you have to have, I'm only a stem cell doctor, I'm only a knee replacement doctor. If you come to somebody who really specializes and wants to know all about the conservative treatments as well as the surgical treatments, That's the important thing, to get an opinion from somebody that sort of has the whole scope.
That makes sense. What a great overview. Thank you, Dr. Stewart. We enjoyed that. If you are looking for any additional orthopedic information, as we said, Dr. Stewart is a hip and knee specialist and part of the group Sforzo, Dillingham, and Stewart Orthopedics and Sports Medicine. You can find them by going to sforzodillingham.com.